Knee and hip pain can strike just about anybody. The issue being that, especially when it comes to the knee, because it's stuck between the proverbial rock and the hard place being the knee and the ankle, which are very complex joints. Not that they're so complex that we don't know how to remedy some things, but the knee and the hip have this relationship where you have these big drivers, right? You got your quads and your hamstrings that play a little battle to create stability, to drive force, and build our amazing body machinery so that we can go and do all the awesome exercises and activities that we love to do. One thing that can happen though, specifically at the hip, is that we can get really tight musculature, especially on kind of what I call this front quarter panel, right? The TFL, the tensor fasciae lata, little muscle kind of off into the front, and the glute med, the gluteus medius. Those two muscles, again, you don't need to ever remember these names, but those muscles help with the stabilization of the leg. And if we don't have stable hips, we recruit our low back, we recruit different muscles in our legs. This can contribute to IT band stiffness and pain, and also low back pain, hip pain, all that stuff included. So what we're going to talk about today is using the lacrosse ball to get into those tissues to start to get them to relax and take away some of that pain signal. So what I want to do to kind of get a ballpark of where I want to be, I want to find, if I think of my leg bone, there should be a bony kind of point out on the side of the hip, right? A lot of people point to this and they go, oh, this is my hip bone. Unfortunately, right, we also like to come up onto our hip here, that kind of ridge that comes over here, the iliac crest, if you will. Don't remember the name. This bone, right, we also say that this is our hip bone. Both are neither correct, but we get the premise right. We want to be in between that trochanter, that leg bone, and that iliac crest, that actual hip ridge right here. All of the space in between there is fair game. What I'm going to do is I'm going to lay flat down on my back, and I want to take that lacrosse ball, and in between those two spots, again, the leg bone here and the hip bone up here, I'm going to place it on the side. And what I can do just to start off is I can take the lacrosse ball with my hand and just kind of poke around and go, are there any tender spots I can first find? Once I find one, for me, you know, it's a little bit farther back and up, I'm going to hold that lacrosse ball there, and I'm going to rotate my body onto it. Now, I don't need to rotate too far. I just need enough for that ball to stick, because what we're going to do is we're going to get our muscles to contract and relax and work into some more intense positions. So, once I'm on the ball, nice and stable, what I'm going to do, looking down at my foot, is I want to keep my leg nice and straight. I want to rotate the entire leg up and in towards the inside of my body, okay? So it looks like my toes are pointing up towards the ceiling and coming back down, up, down, up, down. You might see, if you look at the lacrosse ball, as I contract that muscle, it actually, or move my leg, I should say, the muscle contracts, and that allows me to fire into it, fire, and then when I relax, I can see deeper into that intense spot, that achy spot. I do this for about 4 or 5 times, and then maybe I roll my body over it more, so now I have more pressure into that ball. I like to spend about 1 to 2 minutes working through these tissues to start to release them. I can also, in the same light, bring my leg up, kind of like I was sitting in a chair, right? So now I have this 90 degrees of hip flexion, right? Bringing it up towards my chest. 90 degrees of knee flexion, again, like I was sitting in a chair. And what I can do is I can push the leg down into the ground. So I'm imagining pushing that leg completely down, that entire shin bone's pushing into the ground. I push there, that again gets that muscle to contract. And then when I let go and relax, I can sink down deeper into the ball. I'm gonna do this through the entirety of this kind of quarter panel back here, right? Where I can work a little bit more onto the front, I can work a little bit more into the back, but again, almost like as if there was a horseshoe locked around the side of my hip. All of that is fair game, and I want to spend about 2 to 3 minutes in total per side just kind of working through those tissues. That's a great way to start to tune things down. I love to do this right before bed. It gets us nice and ready for sleep time. We're getting good blood flow into the area, which should improve our recovery on our days off.